the problems that teens face here and in other places are access to information, to unbiased information, access to services, especially reliable contraception. And I say that because non-prescription contraception, birth control is available obviously in the form of condoms, sort of in pharmacies. That's hard enough to access. The most effective forms of contraception require seeing a healthcare provider and either require prescription, but even the best forms require actual placement in a clinical setting. So that barrier is something that teens may face. Schools are not able to help get people where they need to get in terms of both information and referrals. Not only are they creating a barrier, but they're also sending a message and reinforcing stigma.
A common problem that we actually run into in our clinic is we can, as providers, talk to teens confidentially, but then any prescriptions that we would give for birth control or any laboratory testing for sexually transmitted infections, we can't promise the teens that it's not going to show up on their parents' bill for the insurance. I've seen, unfortunately, many patients with unintended pregnancies and who were not taking any form of birth control, and whether that is from lack of knowledge, lack of access, it's probably a combination of those things.
It's interesting to me how few people know about the corners, so I want to make sure that people know that adolescent health centers in the schools are a great resource, and that young people can come here as a resource too, from all over the county and even out of the county. So I don't know that young people in Ann Arbor know that they can come to IPSI for health care. There's been a really interesting rise in STI rates recently, especially syphilis, which has been interesting. Syphilis and HIV is now highest in adolescents. Many more people die from complications related to HPV, complications like cancers that you can get from HPV, than tetanus. But nobody thinks about not getting a tetanus shot, right? But everybody's afraid of getting this HPV shot. There's a lot of issues around LGBT youth who might get sex ed but might not feel like it's being taught to them, since a lot of the sex ed that's out there is pretty heterosexist.
I have met one person who had an unwanted pregnancy. 1 in 2 people by the age of 20 are going to acquire an STD. So I think it has a lot to do with people not wanting to talk to their parents about being sexually active, and not knowing that they can have access to sexual health care without talking to their parents. I think there's a lot of issues with knowing when to get tested. People don't know, they think that just because they don't have symptoms, they definitely don't have an STD, which isn't true. I see a lot of disparities between Ann Arbor and places outside of Ann Arbor. So in Ann Arbor, we're pretty lucky with our education and we have a great system, but even with all of our resources, kids still don't know where to get birth control.
Teens are having sex and they're putting themselves at risk. It's healthy and expected to be curious about your body. It's often hard for teens to access the sexual health services that they need. Most teens don't want to talk to their parents about sex. They don't want their parents to know about it. Even if they have a provider that they want to see, they're afraid to tell them. And so we need to have a place for teens to go and a system to be able to access the services that they need, so we can reduce those disparities.
terms of the school referral system that you're talking about, I think that's a wonderful idea.
And I think it's really important for young people to know that there are people in their schools that care about them, and that, SHIFT is this great initiative because there are teachers and counselors and nurses that really want to make these resources available.
Well, one thing I think is important is that teens know that they have access. By law, they have the right to access confidential health services.
I think that it would be great if they could go to teachers and ask them where to get birth control for an easy access way to get it.